Afternoon, everyone, and whoa, sorry about that. Trying to make sure that. All right, sorry about that. Good afternoon, everyone, and welcome to the UCSF Fitness and Recreation Wellness Webinar Series. I'm your host, Joey Convento. Today's webinar installment is Self-Care Acupressure, empowering you to help deal with pain and improve health through increased awareness of the subtle energies of the body. Joining us today will be Marcia Degelman. Marcia has been practicing and healing the healing art of massage therapy over 30 years. She incorporates many styles of massage into her work, including Swedish, gentle shiatsu, lymphatic drainage, and craniosacral therapy, and orthobionomy, which is released through positioning. She's also certified in pregnancy, labor, and postpartum massage therapy, and has been in private practice in San Francisco since 1980. In addition to her work at Osher Center since 2004, she provides inpatient massage therapy for pediatric patients at UCSF Benioff Children's Hospital at Mission Bay as part of the Integrative Pediatric Pain and Palliative Care Team. Ms. Degelman developed light touch acutherapy, a very light touch along the acupressure meridians for cancer patients undergoing difficult treatments such as chemotherapy, bone marrow transplant, to alleviate pain and discomfort. She has also developed a soothing circles light touch protocol on the lower back in a side-lying position for patients with digestive disorders. Now, before we start, we encourage you to use the chat function to submit your questions that will be answered at the end of the presentation. And now, everyone, please help me welcome Marcia Degelman.
Hello, good afternoon. Thank you so much for joining us today. I'm going to be going through some points that you can use for yourself for pain and tension. And I thought we'd get started with just some shoulder exercises. So if you go ahead and join me, we're going to breathe in and just let your shoulders float back down. So again, you're going to breathe in, let your shoulders rise. And on the exhale, let them float down. Okay, this time we're going to take a slightly deeper breath. We're going to bring our shoulders all the way up to our ears and let them hang there for a minute and let them down. So we're going to breathe in again. And this time we're going to rotate our shoulders back. So breathe in. Rotate your shoulders to the back and let the tension go. One more time, bring them up and rotate to the back. This time we're going to bring them in and rotate to the front a couple of times. And one last time, we're going to bring our shoulders up and rotate to the back. All right, so people have been spending a lot of time on the computer lately, so I thought we'd do some finger exercises. So go ahead and wiggle your fingers. And then we're going to rotate our wrists. I'm going to go one way and then the other way. Now I'm going to invite you to stand up, because one of the things that's really good to do is to change your position. Don't stay sitting for too long. Sitting is the new smoking, so you want to do a little of it, but not too much. And rotate, we're rotating our elbows here. Okay. Now we're going to make a big circle with our arms. And another one of those. All the way up. And one last one. Okay, so now we're going to start with the points, and we're going to start with this point here, large intestine 4. So you can just see the points that we're going to do, and I'm going to take this off the screen now so you can concentrate on actually doing it instead of looking at it. So what you want to do is you want to So you want to, the point is but in the webbing between the thumb and the forefinger. So you want to press here strong enough so that you can feel it. And you want the direction of your pressure to be going towards the index finger. Turn here. And just for about 10 to 30 seconds, press and hold this point. And this point is good for headaches and digestive problems. You can see what it's like on the other side as well, and you can compare the 2 points. Sometimes you'll feel like one side is more empty and the other side is more full. You can go back and forth and see if you can get the 2 to equalize. And then you can hold the point for a while until you feel a slight pulse. Okay, so that's large intestine 4. The next point we're going to do is this pericardium 6, which is a point for nausea and also for motion sickness. If you get car sick, it's a good point. If you've ever seen those C-bands, they're like an elastic band with a little bead in them, and this is the point that they are trying to stimulate. So the point is between the 2 tendons. So if you let your wrist go a little limp, it's easier to get in between the 2 tendons. And the point is kind of deep, so you have to press a little hard in between, and you'll feel a point that's kind of sensitive there. And you can hold that with a steady pressure for about 30 seconds. And again, you can see if one side is fuller than the other. Again, you can feel a slight pulse. Okay. So now what I'd like to do is have you work this next point here, which is gallbladder 21, and it is on the corner of your shoulder. So you can, I'm going to actually turn around. I think you'll be able to see it better. So if you have your hand like a claw, and then you grab that corner of the scapula. This is a really popular point with just about everybody. It's really good for shoulder tension and for headache, too much computer use. It's a really good point. It's a very good point for nausea as well. It's a good point for releasing tension in the shoulder. And you can support your elbow with your other hand, and then just let that arm drop, and it helps you get more pressure in there. And you can go ahead and massage that whole trapezius. We carry a lot of tension in this muscle. You can work that whole muscle. And then the other side, so you're going to support the elbow with the other hand, make a claw with your hand. And this is a point that can take a lot of pressure. I think if I could only have one point to use, it would be this one. I think it unlocks more tension than almost any other point. Feels so good. So do the whole trapezius. And then what you can do is make a soft fist and use the side of your hand. And we're going to just do little taps along this whole shoulder blade here. And then we're going to go down the outside of the arm and up the inside. Down the outside. Large intestine meridian going up the inside is the lung meridian. And one last time down here. And another point I want to point out to you is in the pad of the thumb is the first point of the lung meridian. It's a really good point to know about. What with everyone being so conscious about their lungs these days. So again, on the pad of the thumb. And go ahead and make a fist. We're going to tap down the outside of the arm and up the inside. And down the outside. And up the inside. Okay, so now if you like, you can take a seat again, and we're going to do some points on the face. So if you have a desk in front of you, you can rest your elbows on the desk, and you can very gently place the pads of your thumb right at the corner of your eyebrow. And you're not going to be pressing with your thumbs into this point, but rather the weight of your head. The more that you relax your head, the deeper the pressure will be. So again, you are in charge of this, and you just want to go as deep as feels good. This is a very good point if you ever get migraine headaches. This is a great point to know about. And you want to be gentle in here. You want to go along the ridge of the eyebrow. And then you can actually pinch the eyebrow. That's something that feels really good. It's really good for eye strain. And we can work along the ridge of the nose. And down in here, this is a really good point for sinuses. If you ever get sinus headaches, this is a great point for that, right at the base of the nose. And you can work your way all the way around. Another point for just general tension is the masseter muscle. This is the most used muscle in the entire body because the relaxed position of your mouth is actually for your mouth to be open. So think about how much we flap our jaws around talking and eating. So this muscle stores a lot of tension. This is a really good muscle to work on. Okay, and then you can come back to the eyebrow, and you can do little circles on the forehead, on this frontalis muscle. This is really good for tension headaches. Just, you know, I don't know about you, but I find myself doing this a lot these days. Oh my God, I can't believe what's going on. So this is good for that. Clearing the craziness of our times. And just go ahead all the way up to the hairline. And then up into the scalp. You can move the scalp. This feels really good. And then you can make your fingertips kind of light and do kind of like little raindrops on top of your head. And you can work to the back of your head. And then there's another point I'd like to tell you about. I'm going to turn around for this too. This point right here at the, it's gallbladder 20. It's right at the base of the occiput. This is a really good point for insomnia. If you're having trouble sleeping, you can just place your fingers here. Imagine you're on your pillow. You can place your fingers here. And this point will really help you get to sleep. And you can do little circles along the occipital ridge here. It's really nice too. And then to work on the neck, you can again put your head put your elbow on the table and your head in your hand. And see if you can get your neck to relax. You can massage your neck. There's a lot of eye strain that accumulates back here. Okay, and then you can end again with a little tapping on your neck and shoulders. And you can come around to the front here, and right at your breastbone, right behind your breastbone, this is where your thymus gland is, you know, where you make T cells. So it's nice to kind of stimulate that for immune function. Okay. And then another really nice place to work that's easy to get to are your ears. So you can pinch all the way around your ear, and especially your earlobe. And I'm just going to take this out. The cartilage above your earlobe is a really nice point. If you ever have a toothache, there's a really good point at the very tip. So here's your earlobe. And if you go in right at the corner here, there's a point that's kind of exquisitely sensitive. And you can press this point and it will interfere with the pain of a toothache. And it's nice because you're in control of this pain. You can distract yourself with this kind of pain by kind of an on-off pinching motion. All right. And then you can just do the whole ear. This is nice if you're ever like falling asleep driving. This is a nice thing to do. Kind of wakes you up, makes you more aware of what's going on. Go ahead and do the other ear too. Okay, and then you can squeeze them both. Okay, so another point that I'd like to tell you about is stomach 36. And this one is actually on the leg. I'm going to bring my leg up here. So it's about 3 finger widths from the kneecap. And it's between the tibia and the fibula, between those two bones. And if you press in there, this is a really nice point for any kind of digestive issues. It's a point that I use a lot with the babies because it's kind of a neutral point. It's a nice way to start a massage with the babies. And it's on both legs too. It might be a little easier to see on this one. So here's the kneecap, and then it's between the two bones. And again, you want to press it for about 30 seconds. You can make little circles in here. That's kind of nice too. Okay, so what I'd like to do now, if you would, see everybody here, is ask you to stand up again. And we're gonna do some knee circles. So you're gonna put your hands on both knees and you're gonna circle your knees to one side. About 8 times. Then you're gonna go the other way. And then you're gonna put your hands on your hips. And circle this way. These are nice little movements that you can do. I don't know if people had the chance to see the other videos. There's a really good video on ergonomics, and they talk a lot about taking breaks, getting away from your desk for a few minutes and doing some movements. So these are really nice movements to do. Circles. And then we're going to end with a little chi circle. So what I want you to do is have your fingertips facing each other. And you're going to breathe in. And then you're going to bring your fingers together towards each other, and you're going to sink. You're going to soften your knees and sink and stay down. Okay, you're going to breathe in, bring your arms up, stay down. And then you're going to let your arms sink, and you're going to straighten. So again, here, I'm going to do this again. So you're going to breathe, let your knees be soft. So you're going to breathe in. And then as you exhale, you're going to sink. You're going to stay down, let your arms come up. And as you sink your arms, you're going to straighten your legs. One more time, let's try that again. Breathe in and sink. Stay down, let your arms come up. And this time, you're going to put your hands on your belly. So this is your dantian. This is where you're going to store your energy. So just go ahead and take a couple of breaths here. Really feel your abdomen. Let your abdomen be soft so you can feel it expand as you breathe in. And imagine that you're sinking your energy and storing it here for when you need it later. Now you can let your hands come up and see if you can have that sensation between your hands, kind of a magnetic sensation. This is the chi in your body. And so a nice way to end is just to give yourself a little chi rinse here. So you're going to gather the chi. And rinse. And one last time. Okay. So I invite you to have a seat again. And one of the important things is to change your position, to just get up out of the chair every so often, every 20 minutes or whatever, and just have a change of position. It's really good for you. So I think we have some questions here. I'm going to take a look at the chat.
Yeah. Thank you, Marcia.
So let me. It is Garcia on the back wall. I'm going to put up that. I'm going to put up that the handout again, and I'm also going to scroll down so you can see the face points. Let me see if I can make that even a little bigger. Let's see. Oh yeah, you can really see it. Hold on.
All right, Marcia, thank you. I'm going to read through some of the questions that they have here. All right. So first question here is,